Perfect. Great. Well, first of all, I'm so happy to be here today. Thank you so much all for having me and for being here to listen to our talk today. Feel free to message in the chat if I ask interactive questions or just think the answer in your head to yourself as well. Today, I'll be talking about genetic counseling and how genetics can be a factor in our health. So just an introduction and a little bit about me. My name is Juliana Williams. I use pronouns she, her. I grew up in Phoenix, Arizona, and have lived in Arizona. And I'm a member of the Tohono O'odham Nation. I went to the University of Arizona for both of my programs. So I got bachelor's in molecular and cellular biology, which is just, a fancy name for biology of cells and all the small parts that you would see with the microscope. And then also another degree in psychology. I also recently graduated and have a Master of Science in Genetic Counseling. So I graduated back in May, and I'll be talking about genetic counseling today. And this picture right here is just me and my classmates. There were 5 of us in our year, and we all recently graduated. So I just wanted to start off with a little icebreaker to get us thinking, what are some factors that can impact our health? What are some examples? So I want you to either, think to yourself or send an example in the chat of factors that can impact our health. So I'll give you a second to think about that. And there are many correct answers to this question. Yeah, thanks so much for sending answers in the chat. Some people said daily routines, income, our environment, diet. Yep, definitely right on. So just an overview of what I'll talk about today. I'll review some into genetics and how genetics can affect our health. And I'll talk about genetic counseling, what it is, the importance to our health. And then I'll talk about my capstone project, which is a project that I did as part of my master's program in genetic counseling. So factors in our health. Some of you already mentioned some of these factors. So there might be individual factors such as age, sex, ethnicity, gender identity even. These can all play a role in our health. There's also lifestyle and behavioral factors such as diet, exercise, tobacco, alcohol usage, things we're just exposed to in daily lifetime. And then there's also emotional and spiritual components. Those can impact our health as well and are very important. Lastly, there's societal and social factors, these larger systemic factors such as income, access to healthcare, inequality. These can all play a role as well. So in summary, there's a lot of things, right? And I'm sure you all know this. A lot of things can affect our health. But the one thing I'm going to talk about today is genetics. So genetics and how it connects us. I wanted to talk a little bit of just some background into genetics so we can understand it through the lens of genetic counseling. So an introduction to genetics and into biology. So cells are the building blocks of all life. Our body is made up of cells. So right here, that's me and my classmates that I showed you earlier. We're all made up of these little cells, as you can see. All types of the different cells, cells in our lungs, skin cells, all different types. And if you look over here, cells also make up other living things, such as plants and the creosote. And that's just something I think is beautiful. Cells make up all of life and help our body to work. Cells have different functions to keep us living. But how do our cells know what to do exactly? How do they work? Well, there's something called DNA, which I'm sure some of you have heard of before. DNA, I like to think of it as the instructions for our cells. Our cells look at the DNA, and the DNA gives instructions for how our cells are supposed to work. And the DNA has different spellings to it, which is I like to think as different spellings for words in an instruction manual. So here's some examples of different letters that make up the spelling of DNA: C, G, A, and T. And they're shown in the different colors here. So like I said, so DNA, it's in every cell of our body, and it helps our bodies know how to work. Segments of DNA that serve a specific function, I like to think of them as an instruction sentence in the manual, are called genes. So genes are a sentence of instructions for how our body or our cells are supposed to work. And I just like to give that breakdown so we have some knowledge going in when we talk about genetics and how it can impact our health. So I like to include this little diagram as well to show that differences in how our DNA is spelled can lead to differences in how our body works. So on this left image right here, we see DNA with a spelling of, just for example, ATAGGG. And that spelling makes this cell. It helps make this circular cell a bluish gray color. Let's say, for example, it helps our lungs work or something like that. However, if someone has a spelling that's different, let's say instead of a G in the fourth letter, it's an A, that can sometimes lead to a cell that works differently in our body. Maybe the lung cell on the left normally helps our lungs function, but if the cell works differently, maybe our lungs function differently, or maybe they're not able to function as well. And that's the type of DNA changes that we think about when we think about genetic counseling and genetics in healthcare. We look at these changes or differences in how someone's DNA is spelled that can impact their health and how their body works. And these are called genetic conditions. And one thing I do want to know, of course, my whole field is focused on genetics and how it affects your health. But I want you all to remember that's just one of the factors in our health, right? And genetic conditions in the context of all things are pretty rare. However, because there's something we're able to learn more about, it can be instrumental in helping people with those genetic conditions. So just another comparison, I like to think of DNA like making a basket. So DNA is like the instructions and how you would know to make the basket. So if you change the DNA, you might get a different result in how your body works. And this can be shown if you change the way you make it, the basket, you might get different results. So these top two are both circular baskets. They look similar, but the bottom one looks completely different, right? So sometimes those DNA changes don't change your health much, but here in this lecture, we're talking about the bottom result where it does change how your health works, which are genetic conditions. So next I wanted to talk about genetic counseling because that's what I'm here to talk about today. And I wanted to ask you if you've heard of it, feel free to put it in the chat or even just think it to yourself. What is genetic counseling? And I put a hint there, genetics plus counseling. But I'll wait a minute. Feel free to enter your response in the chat, even if it's just a guess. Great, we got some people guessing or answering. Yeah, someone said giving advice about what to expect when pregnant based on genetic background. Definitely. And I'll actually talk about that as one of the types of genetic counseling in a bit. Someone said helping explain people's risks or interpreting genetic test results. Definitely. Great. So I'll go ahead and review genetic counseling a little bit. Thank you for your answers. So genetic counseling, as I said, I like to break it down into genetics and then also counseling. So genetic counselors are healthcare professionals that help people understand genetic conditions. So genetic counselors have this knowledge and understanding about genetics and those genetic conditions that we were talking about earlier. They also educate patients about those genetic conditions, offer genetic testing if applicable, and also provide emotional support to patients. This is something that we really learned in our program and is really emphasized in genetic counseling programs. Genetic counselors are trained to really get to the root of how people are feeling throughout the process of a genetic diagnosis or seeing a genetic counselor. So if you end up seeing a genetic counselor, that is something to expect, some emotional support. And then genetic counselors also work in hospital settings, as well as laboratories and industry settings, which are usually larger companies, often online, and can provide a remote service to people as well if they're not able to see an in-person genetic counselor sometimes. I also wanted to include some things that genetic counseling is not. So genetic counselors do not create designer babies. I'm not sure if you have all heard of this concept, but designer babies are this sci-fi concept that if science has gone too far, things might evolve to where people pick and choose what their future baby's going to be like. So maybe designing their baby to be an athlete in the future or something like that, or being super smart or something along those lines. But genetic counselors do not do that. Um, but it is something to think about and is important to think of when we're considering the ethics of genetics. Next, genetic counselors do not clone people. And lastly, genetic counselors do not force people to get genetic testing. And this is really important in the consent process. If someone decides to get genetic testing, which I'll talk about in a bit, we go through the whole consent process with them and make sure it's something that they're actually interested in. At the end of the day, genetic counselors are there to support and teach people. So just a review of genetic conditions and then talking about genetic testing. So genetic conditions are those health differences due to changes in DNA or those differences in DNA spelling that I was talking about earlier. And this can include a wide variety of different health conditions. Genetic testing, it looks for those DNA changes that can cause those genetic conditions or that might increase the chance of those genetic conditions happening. And the way that genetic testing works is that if someone is interested in genetic testing, we take a sample, which is either saliva or blood draw most of the time, and we send it to a lab who specializes in genetic sequencing. They look at the DNA to see if it's spelled in a way that's associated with any genetic conditions or predispositions for those genetic conditions in someone's lifetime. And this can help people find a proper diagnosis and treatment, which is really important and can be really helpful and sometimes life-changing to people. One example that I think of when finding a proper diagnosis for a genetic condition is when I was in a pediatric clinic. And some people would bring in their children, and their children had these different health conditions or symptoms, but the parents and other health providers and doctors didn't exactly know what was going on. They didn't have a diagnosis yet. And in these cases, sometimes genetic testing was able to provide a diagnosis. And this can be really helpful, of course, because from then on, maybe they're able to find proper treatments for that genetic condition that can improve quality of life, or know what to expect as the child ages and gets older to provide proper support, which is one thing I really like about genetic testing, is that it can really help someone's life moving forward. And then it can also help with treatment as well. And I'll talk about another example of cancer genetic counseling in a little bit. So here's an example of a typical genetic counseling session if someone's going to see a genetic counselor. I know when I first started looking into genetic counseling programs, I wasn't completely sure what every appointment looks like, so I wanted to provide you with a bit of a structure. So first of all, if the person comes in, I'd ask them about their personal health, why they're there, any health problems or symptoms they might be having. Then I'd go ahead and write out the family tree, or what we call a pedigree. We go ahead and draw out the family tree and write out any health conditions in the family. See if there might be any patterns that we're trained to see. Then we talk about options, which might include genetic testing, an option of maybe they don't want genetic testing, or maybe now's not the best time for it. Or, if they need to be referred to another specialty that can help them further. Next, we help the patient find the right choice for them. And that's really important in this process, having for them to have someone to talk to about these healthcare decisions. And then lastly, if they decide to move forward with genetic testing, when the results come back, we explain all of the results to them and answer any questions, explain what this may or may not mean for their health moving forward. And then we can also provide a family letter so that they can communicate these results with family members if they'd like to. And here's some types of genetic counseling. And these are the different types of genetic health conditions that can be considered in different genetic counseling types. So one type that I mentioned is cancer genetic counseling. And cancer genetic counseling looks to see if the way someone's DNA is spelled can lead them to having an increased chance of cancer in their lifetime. It doesn't diagnose if you have cancer or not. It just says whether you're at an increased risk of having it in your lifetime. And this can be really helpful for people. Some people with cancer already might get genetic counseling done and genetic testing done to see if there is a genetic link to their increased chance of cancer in their life. Sometimes if they have cancer and they find certain genetic testing results, they might be able to have different types of treatments that are more effective. Or some people might come in without cancer, but with a family history of cancer and want to see if they have that increased chance of cancer due to their DNA. And then if they find out they do, there are usually steps that they can take, which is something I love about the utility of genetic testing. Because if someone finds out they have an increased chance of certain types of cancer, they might be able to get more screenings done, such as mammograms, for example, maybe more often or at a younger age. They also might know that they benefit from risk-reducing surgeries. One example is having ovaries removed. That can greatly reduce the risk of that cancer happening in the first place. And now these are all decisions that people need to consider with genetic testing and genetic counseling, which are things that we talk to them about. And yeah, it can be really helpful in finding the cancer early or lowering the chance of it happening to begin with. Now, there are other types of genetic counseling here. So cardiology, seeing if someone's DNA makes it more likely for them to have certain heart problems. Prenatal genetic counseling, which someone had mentioned in the chat earlier, which is looking into if someone's interested in having a pregnancy or is already pregnant, to see if the pregnancy might be affected by certain health conditions. And this can be helpful too, because it can help someone make reproductive decisions about their pregnancy. And it can also help them have a pregnancy plan. So if they find out that their pregnancy is affected by a certain genetic condition, they might be able to plan to have certain treatments after the baby is born, or try to get care at a specific hospital that specializes in that genetic condition. There's also pediatric genetic counseling, which I mentioned, which is basically a wide variety of specialties for children. And then there's neurology, looking to see if the way your DNA is affects the way your brain works and body. And lastly, there's teratology, which is something I hadn't really heard about until I was applying to genetic counseling programs. And teratology looks to see if exposures such as alcohol or medication or other drug use can affect a pregnancy's health or a baby's health when they're breastfeeding. And there's actually a really cool service through the University of Arizona. It's called Mother to Baby, that people can contact if they want to learn more about the effect of exposures on pregnancy. So I was talking about family history, so I wanted to give an example of that. Family history or pedigree. So this is a take on my family history. It's not my exact family history, but I wanted to provide a real life example. So this arrow here is pointing to me in the circle. Branching out here is my brother and then my other sibling. If you move upward is my father on the left and my mom on the right. And I want you to either think to yourself or enter it in the chat. Does anyone know what this diamond might mean? The circle is female and the square is male. So if you have your guesses in your mind. In this example, the diamond means non-binary. So that's my sibling right there in the middle who is non-binary. And I did write AFAB underneath because they're assigned female at birth. We don't always need to write what they were assigned at birth underneath, but in some cases, certain genetic conditions might only affect certain organs. So sometimes writing what they're assigned at birth can provide more information on that. Now branching out to the side, so that's my mom right here, that's her brother. Moving up, that's my grandma, and that's my grandpa. And then if you move over to the side here, my grandma had children with two different partners. So these are technically my mom's half siblings. She views them as her whole siblings, of course, because they're all a family, but biologically would be half siblings. Branching out here is my dad and his brother and sister. And then moving up here is my grandpa, my grandma, my grandma's sister, my grandpa's brothers, and so on. And I like to note that, every person's family is different, and that's completely fine and normal. And some people might not know about their families, and that's okay as well. For example, my husband's adopted, so he knows about the family he grew up with, but he doesn't know his biological family's health history. So in those cases, genetic testing can be helpful because sometimes it can provide knowledge about things that people don't know about because they might not know their family history. And I will leave time for questions at the end as well. So if you have any questions, think of them now and feel free to write them down on a paper for later. So I just want to talk about some reasons I wanted to go into genetic counseling. So first of all, I just have an interest in science and psychology. When I was an undergrad for college, I knew I was interested in science, but I wanted to do something more with interacting with people and supporting people directly. And when I found out about genetic counseling and looked into it more, I thought it was the perfect fit for those interests. Second of all, my own family history. So one thing is that, first of all, with cancer, it's sadly pretty common. So growing up and hearing about loved ones affected by cancer, as well as my own family members affected by cancer. That's something that has really expanded my interest in cancer genetic counseling, being able to serve people throughout their healthcare journey. Which hints at one of my other reasons I wanted to be able to serve others and serve our community here in Arizona in any way that I can. And lastly, some future and long-term goals of mine are to work as a clinical genetic counselor, which is in the hospital setting that I mentioned earlier. I am really interested in cancer genetic counseling, but other specialties are interesting to me as well. And lastly, I would really like to expand access to care for genetic counseling. There are not a lot of genetic counselors in Arizona. In my opinion, there are not enough genetic counselors in Arizona. So being able to have more genetic counselors available, especially to rural populations, so you don't have to drive as far, is really important. There are also no genetic counselors in IHS, Indian Health Services. So being able to expand access would be really important. And that, of course, is a long-term goal. That's not something that will happen overnight. And lastly, before I talk about my capstone project, I wanted to include some bonus slides for if people are interested in genomics or genetics or know anyone who is. There's this really great internship called the Summer Internship for Indigenous Peoples in Genomics. It's not something I'm a part of, but I think it's really interesting, so I wanted to share. It's a summer internship, which sounds like what it is, addressing the lack of Indigenous representation in the scientific community and increasing knowledge of Indigenous cultural values in the field, so you're able to learn more about genetics and genomics. And they're not doing it this year, but they're planning to do it next year. So if you're interested, just keep an eye on the website. They're updating it in progress right now, but it's singconsortium.org. And that's available for young professionals, as well as graduate students, undergraduate students. Next, I wanted to include a quick example of Indigenous-led science, which is called the Native Biodata Consortium. It's this really great program that's owned and operated by the Lakota people, led by Indigenous science on the reservation. And it's working to improve the health of their community. They're keeping the knowledge for themselves to help themselves, which I think is really beautiful. And it's something I would love to see expand over the years if possible. Great. So now I just wanted to talk for a couple of minutes about my project that I did as part of my master's program for genetic counseling. It was called Culturally Inclusive Outreach on Genetic Counseling in Underrepresented Populations, with an emphasis on Indigenous groups in Arizona. And I'll talk a little bit more about what that was. So for my project, like I mentioned, this was for my master's program in genetic counseling. And it's because genetic counseling just doesn't have a lot of diversity in the field, sadly. I have this pie chart right here, and the majority of genetic counselors identify as white or Caucasian. And then about a sixth of genetic counselors are other racial identities. And this tiny sliver right here that I had to have an arrow pointing to so that you can see it better is 0.4% of genetic counselors who identify as either American Indian, Alaskan Native, Indigenous peoples of Canada, Native Hawaiian, or other Pacific Islander. So that's a tiny sliver right there. So the goal of my project was to tell more people about the field of genetic counseling, especially non-white populations, and I wanted to include Indigenous populations in that as well. So that if people know about the field and they're interested in it, they know it exists. So if they want to become a genetic counselor, they're able to look into it. So what I did for my project is I created educational materials so people know that the field exists. And these included a pamphlet, web pages, and then a presentation. The presentation I used was usually very similar to the first part of my presentation today. I also conducted outreach, which included giving those presentations and then distributing those pamphlets that I made. And here's a table of the different outreach I was able to do. So it included a bunch of classroom presentations to high schools in general, as well as a tribal college, the ACES Regional Conference, and then talking with school counselors and different teachers about the field. Because if they know about the field, they can tell students about it. And then here's a pamphlet I made. I wanted to make sure to include some visual diversity for people, as well as information about genetic counseling and links for people to learn more. And lastly, I included a snippet from the website that I made and designed. And this includes information more about the field, as well as a lot of resources for if there's any students who are interested in getting into the field, there's some resources to help them get started. Because I know that when I was starting, it was difficult. But one of these pages can also be helpful for if you're interested in getting genetic counseling for a patient as a patient. And I'd also like to note that Agnes Adekai, who is in the Zoom room right now, she was part of my committee, and she was a great resource for me. But yes, in addition to this, I presented the presentation to groups as well. And there's a QR code if you're interested in learning more. It's on the University of Arizona Genetic Counseling Program's website. But yes, thank you so much to all of you today. I appreciate you being here to listen. And if you have any questions, feel free to let me know. I also included my email here for if you prefer email contact.
So Juliana, thank you very much for a wonderful presentation, providing us information on genetic counseling and what it means, to sort of demystify what it is, and the fact that we need more genetic counselors of diverse backgrounds to help, provide counseling as well. So thank you. And are there any questions for Juliana?
I'm curious if you want to tell us if you have found work in your profession and what you're doing now or are looking.
Yeah, that's a great question. So I have been looking into jobs and nothing yet. I've been looking more for the Arizona area right now. Like I said, genetic counseling is a really important field and it has been expanding. But currently, right now with this job market, we're kind of in between times of expansion. So not a ton of jobs right now. So I'm still looking.
Thank you for the presentation.
Yeah, thank you very much.
So Juliana, can you talk about what your next steps are that as a genetic counselor, your next step is to pass your exams, correct? Can you tell a little bit more about what that entails?
Yeah, so I'll be, we have what's called board exam, and that for me, I'm taking it in August. They do it twice a year. And that, it's kind of what it sounds like. It's studying everything that we've learned in our 2 years and passing that. And then once we pass that, we're able to have the title of a certified genetic counselor, which is usually required by a lot of jobs, but not all of them. So, and then from there, continuing to look into work for genetic counseling, as well as honestly other jobs in healthcare that I think I could support people through.
We do have one question in the chat from Lizzie, who says, Why do you think there are so few genetic counselor and counseling roles in Arizona? And why none in Indian Health Service?
Yeah, that's a great question. And actually, one of my previous classmates, she did her project on a case for getting more genetic counselors in Arizona. I think there's a lot of components to this. One is that it's a newer field, of course. Um, so maybe this role hasn't really been necessarily known to be needed this whole time. So hospitals are still learning its use. Another thing is that right now licensing is a major thing in Arizona. So in some states, genetic counselors can get licensed, but here in Arizona, we don't have that right now. And there have been a lot of people in the genetic counselors in Arizona who have been advocating and pushing for that in the government, which has been really exciting to hear about it. Because with that licensing it becomes more official, and you're able to order tests yourself, the genetic testing yourself, rather than having the doctor sign off on it. So it kind of proves how much you're needed. But yeah, I think there's a lot of reasons for there's not enough roles. And then currently in IHS, honestly, I'm not sure about that as well. I'm sure some parts include insurance as well, and that can be for throughout Arizona too, as well as in IHS. But Agnes, if you have any knowledge on that, feel free to jump in. But yeah, I think it's kind of a complex thing and a newer technology that people are still learning about.
So I agree. I know that the work I do with cancer and cancer education, there's always questions regarding whether certain cancers have a genetic link and where people can get testing. And that has been, there's been a need for genetic testing, and then there's also been concerns of what genetic testing is. And that's some of the issues you talked about, the myths and the fear of folks regarding what use is, what can happen if people take DNA, hair sample, blood sample, so forth. What happens next? And so there's a lot of concern regarding that. But there is much use for genetic testing because there are some cancers that are linked to your genes. And I think it's a very important role within the cancer care team, but also in any health care team where folks are at risk. So yeah, I don't believe, I think Indian Health Service, will eventually start looking at including genetic counseling in their team. And but I think mostly they refer it out for a lot of folks.